start from, our speaker will start from there on. So I'm Theophilus, Chair of InciSioN Ghana and a surgical training in the UK. Since March 2022, we started this research mentorship program. We've come quite far. We have about 44 mentees successfully matched to mentors. And for those on the waiting list, we enrolled into a series of systematic review and meta-analysis. We have about 23 groups of averagely 8 mentees who are currently undertaking systematic reviews and meta-analysis across areas of their interest. So we have these allocations mainly. And there are different stages of the process. So this was our first webinar by Prof. Efwa Hesse and Dominic Vervoort. It was an interesting one. Our next one was on choosing your study design by Mr. Alan Askari. And then we had ethical consideration and patient consent and study approval that was delivered by Ms. Aisha Durrani and Dr. Asinam Agbeko. And then we had research proposal writing by Professor Daniel Anson and Ms. Alice Chai. And following that, we had a talk on data collection by Mr. Ali Navi and data cleaning analysis by Mr. Alan Askari again. And then we had data interpretation as a 7th webinar by Mr. James Glaspie. And our last webinar was on writing the manuscript, and that was delivered by Mr. Alan Askari. And we have all these recorded on our YouTube page, and so feel free at any point in time to have a look at these. We have been supported greatly by GIGS, by InciSioN Global, and then also by ACE the MRCS, which is a website for the MRCS Part B.
Yeah, I think Teddy has gone off briefly. I'll take over from there. Thank you everyone for coming for our webinar, our 9th webinar of the InciSioN Ghana Research Mentorship Program. It's an honor for me to invite our speaker for today, Tom Drake, who has worked some time with Teddy. Tom is a clinical research fellow in Edinburgh and in Glasgow, and his work focuses mainly on using large epidemiological and genetic data sets to study cancer. He's also involved in a lot of collaborative research work and truly enjoys teaching about research. I'm really glad to introduce him. So Tom, you can take over. Welcome, Tom.
There we go. Sorry, I couldn't unmute myself. Hello, everybody. Thank you so much for coming. My name is Tom Drake. I'm a surgeon and researcher from the University of Edinburgh. and I'm delighted today to talk to you about how to prepare an abstract for a presentation, which Teddy asked me to do. And I'm delighted to talk to the InciSioN Network, and particularly Ghana as well. Went to Ghana fairly recently in the past, before COVID actually. Went to Accra and Tamale. Pardon? But
Tom, I think
just...
I met you in 2019.
Yes,
Yeah.
yes, we did. It was great. And so yeah, I'm really excited to see you all again. Actually, it's really nice. So without further ado, I will hang on. Get my slides up, and we can go through. Wonderful. There we go. Can everybody see that?
Yes, we can see that. Yes, we can.
Thank you. Sorry. Right. So today I'm going to talk about how to prepare an abstract for a submission to a conference. And if anybody's not been to a conference before or has been to loads of conferences, I've put something in here for everybody. So hopefully it'll be useful. So we'll start from the beginning. What is an abstract? As I'm sure lots of us are aware, we read abstracts with papers. They're tend to be the blurb type text that you can you skim read on PubMed. So we'll discuss what an abstract is and what really it should be communicating and how we should be thinking about writing one. We'll then go on to discuss how you make it stand out from everybody else's, so you can, when you submit it to a conference, it'll be very straightforward to get it accepted. I'll talk a little bit about how abstracts are marked and things to avoid that will get your abstract rejected, some common problems, and then we can discuss it all at the end. Yeah, so we should go through that in a logical order, and we'll show you some examples on the way. So kind of going right back to the start, what is an abstract and what does it need to do? And this is an example that I found on the internet on a kind of a research article in a journal. And this is what the abstract is. It essentially is just a very simple description of what you did in the study, how you did it, what you found, and why it's important. And those are the important things just to think about all the time when you're writing an abstract. It needs to be really clear, and it needs to show why what you did is important. So why would you write one? Well, the first thing is that it does offer a concise summary of your work to the reader, and that means that it's quite useful for journals. Say that they get lots of submissions, hundreds or if not thousands of submissions a year. How do they go through that and identify which things they should publish and which things they should just reject? You can't read the whole paper all the time. And the same thing for a conference. If a lot of the very big international conferences, particularly in the field that I work in, cancer, you get these big international conferences where you get tens of thousands of abstracts that get sent in. And if if it wasn't a short summary of what has been done, then you would have no chance in being able to identify which things should be presented at your conference and which shouldn't. So being able to write a very clear and informative abstract is a really useful skill when it comes to research. And why is a conference different from the other ones? Why would you sort of do that? Well, the conferences allow you to go and present your work, and you can meet other people who might be doing similar things, or quite often some of the very senior people in that field will go to a conference to discuss the latest research. So you can meet new people, and you can listen to the latest research in your field, and you can hear about things before anybody else in the world does, which is one of the reasons why I like going to conferences. So you've done a piece of work, it's really great, and you want to submit it to a conference. How do you go about writing that abstract? Often, the most difficult thing is, how do you start? Where do you start? So, like anything, it's really important to have a clear plan, to plan it out, and to plan well in advance. I'll talk about how we find conferences to go to in a little bit, but once you've identified a conference that you might want to go to, or somebody says, this is a good conference to go to, pick that one conference and make a note of when the abstract submission deadline is, so you know when you're aiming for, you know how much time you've got to write it. And if the abstract submission deadline is too close, then probably it's best to leave it until the next year, or go and find another conference, because you don't want to rush something and it's to not be very good. If you've not written an abstract before, it's important that you kind of try and find some help. So ask a more senior colleague, or if you know a colleague that has, for example, done something similar recently, they've presented something, get some advice on what they think you should do, and maybe even just say, can I send this to you? Can you have a look at this? Can you give me some feedback? Because quite often, because when you submit the abstract to the conference, it'll get sent to somebody who looks at it and marks it and says, yes, this should go into our conference. And so if you can find somebody else who can read it, they might be able to catch any sort of spelling mistakes or give you some advice on how it comes across. It's always good to get some feedback before submitting it to the person who will be marking it. One thing I think is really important, and one of these things that we sort of forget about a bit in medicine, is that it's really important when you're writing to keep it nice and simple. So some of the things that we'll discuss in medicine can be very, very complicated and very have lots of big, long words. But if we are trying to get across a complicated topic in an abstract, then we don't need the other words around it to be complicated. So things like the word post-operative, why can't we just say after surgery? Because it just means that people who maybe aren't surgeons, or people who, even surgeons, you know what after surgery means. That is post-operative, but it's just easier in your head because these are the words that you've been using all the time. You don't need to be specialist to be able to understand it. And then you can use that really simple language to illustrate really complicated things. So all of the focus is not on, jargon or, words that describe other things. It's all focused on that thing you're trying to get across. Now, content is obviously the most important thing. You need to have something good to put in an abstract. But what a lot of people, because you've put a lot of work into this big project that you're going to submit to the conference, the temptation is to say everything you've done because it's this really amazing thing you've managed to do. But actually, what's better is just to say the really key things. What is your message? What is the story of what you're trying to get across? Why is the thing that you've done important? And you need just a little bit of information for that, and to just really kind of show that that's really clear and really important. And once you've sort of established that and you've planned it out a bit, and what you could do is you could write the headings for the bits of the abstracts. We'll go on to that in a little bit, and then you could plan what you're going to write underneath each heading, and then just keep it really, really focused and really, really simple. It's important to write in a scientific style. So, like you would read in a journal. And sometimes what I do, if I'm struggling to start writing, I'll go and browse a journal article, or I'll go and find some abstracts from the conference the year before, and I'll try and find the really good ones, the ones I really like, and try and kind of see if I can get any ideas about how to start my writing. So the important things, that the key bits of anatomy, if you will, of the abstract. The first thing is the title. So you've got to imagine who's looking at this. There's somebody who's been sent 800 abstracts to review for a conference, let's say. And so they're spending hours and hours and hours going through this, and they don't want a boring title. They don't want something that's too kind of exciting. They want something that's really clear and just tells them whether this should be in their conference or not. You can make it what you've done. So you can say a randomized trial of chlorhexidine versus povidone iodine, for example. And that's really clear. That tells you what it is. It does what it says on the tin. Or you could say chlorhexidine reduces wound infections. So you could state the result. Or some people would sometimes put jokes in it as well. So they'll make the title of their abstract a joke, so it sticks out to people. It's quite risky sometimes, because you need to know the person who's marking its humor. So that's them, but people do it. And once you've got your title, you're then onto the abstract. So you've got your backgrounds, introductions, names. Now, keep this to a maximum of 3 sentences. One of the things that a lot of people do is they like to kind of introduce everything and say, well, surgery was invented in, before, thousands of years ago. And then they detail the whole history of the surgery. And then at the end, they're like, well, I'm just interested in hernia repair. You don't need to do that. You need to just keep it very straightforward and very clear. So 3 sentences. If you're doing a study on different types of mesh in hernia repair, or mesh versus suture in hernia repair, you just say, that we don't know what the recurrence rates are with this type of mesh or that type of mesh. It's important that we look at all the other outcomes like pain as well. So they're your first 2 sentences, and your third sentence should always be, always tell the reader what you've done with the study. So what is the aim of the study? What are you trying to do? Because then your introduction suddenly links itself into the methods and the rest of it. So it becomes really easy to read. And once you're into the methods, this again, it doesn't have to be very thorough. It just has to tell the reader what you've done. So what type of study design is it? How have you analyzed that data? And what are you telling people in the results section underneath? This isn't an entire paper. This isn't telling people what that they're going to expect in the full thing. This just has to be what you actually did. And then the results, again, what I like to do is, because it's very tempting to put all of the results into a big paragraph. I kind of sit down, I look at my study and say, what is the main message here? And what are the, what's the one number that tells people about this? So then I take that number and then I kind of really focus on it, and I go, well, 40% of people had wound infections after this type of surgery that I looked at. And of those 40%, half of them had a antibiotic resistant organism in their wound, and then a third of them needed to go back to theatre to have it drained, or something like that. So you have a really clear message about why things, if you find a bad thing, so if you find you've got a high complication rate, what happens to those people after they have complications? Do they go back to theatre? Do they die? Do they have problems with their quality of life? You've got to really kind of illustrate why this is important. And finally, and this is probably the most difficult one, is to have some very clear conclusions. So what is really important is that your conclusions are supported by the data that you showed above. You don't want to, exaggerate what you found. You don't want to say, well, I found that in my case report, the hernia went away with the mesh. So therefore, everybody should have mesh, we should give mesh to the world, because your study can't can't tell you that. Your study just, you looked at one person, it was a case report. So you need to be proportionate, and you need to point out weaknesses in your study. And then you need to go on to say, this is why it's important. This is what it means for future research or clinical practice or for patients. And again, maximum 3 sentences. So it's really clear, really concise, and just, what I would usually do, the first sentence would be my key finding. Second sentence would be why it's important for patients or for surgeons or whoever it's targeted at. And then the third one would be, this is what we have to do in future. Really clear. And if you find writing very clearly and writing in kind of very short, punchy sentences difficult, something that's really good to do is sort of list everything that you want to say, and then just delete it. Just go through and just say, I don't need that, I don't need that, I don't need that, I don't need that. Be really harsh with yourself. It's quite a difficult thing to do, but with time, you kind of realize, well, I don't need that. Those words, there's too many words there. We don't need that. So yeah, if you sort of follow those, kind of just be very simple, very matter of fact, and just say what you did and why it's important. That's essentially all an abstract is. But thinking before your abstract, before you've done that, the thing that will get your abstract accepted to a conference is not necessarily how well you write it. It's about your study. Does your study show something interesting? Is there good study design? Study design type things are going to give you a lot more interesting data, and that's going to be much more exciting. And we'll come back to that in a little bit. So one of the things that sort of I didn't maybe necessarily realize, or when I wrote my first abstract, I knew that there was authors involved, but I didn't know the order of them all. Didn't know how that worked. And I found it kind of I just listed all the authors in alphabetical order. And then somebody was like, oh, why have you put that person last? I was like, I didn't know that was the order was important. But apparently it is. So very much how most of scientific structure is or scientific writing structure, sorry. The first author is the person who did the most work. So if you're writing the abstract, usually that's you. So if you've done the project, this is the person who's collected all the data and analyzed it. And this is your project. And the last author, the one at the end, is the most senior person. So this is the person who has been either helping you or supervising you, or is has enabled this to work. And then within the rest of it, sandwiched between them, is the second author will be the person who's put in the next most work. The third author will be the person who's put in a bit less work than the second author and much less than the first, etc. So it kind of goes in order, and then you put at the end the most senior person. So again, like a lot of medicine, there's these unwritten rules. So nobody sort of tells you the etiquette for doing this. And with abstracts, because particularly conference abstracts, the sort of way you do it, or the way that you're meant to do it, is that conferences tend to be for data and studies that haven't yet been published in journals. So they're sort of the way of announcing it to the world. And quite often, conferences like to be the first ones that get to announce that to the world. So what I would say is that if you have done a study, you can present it at one local, one national, and one international conference. And instead of going around all the conferences with the same thing, it's probably just wise to go, if you can, and it's really good, go somewhere international or then national, and then maybe like sort of your local hospital presentation type thing. And you can present data that's already been published, but you just need to be very clear and very open about that. You just need to say, look, this is because quite often that will happen. You'll come up with your paper and your abstract at the same time. You'll submit it to journals or conferences at the same time. And maybe the journal's quite quick and they'll publish the data quite soon. And then the conference is happening in a year's time. So as long as you're open about that and say, look, this has been published in this journal here, you can find out about it, but here are our findings, that's equally okay. And finally, it's really important as well to declare if you've got any conflicts of interest. So was it funded by somebody, or did you get something for free from it? For example, if it was a drug study, did the drug company have did they do the analysis, or did they pay for you to do it, or is there anything that could affect your judgment around it? And one thing that is really important as well is to try and work out with is to pick the right conference for your work. So this is sometimes really difficult, particularly if you've not gone to any conferences, you don't really know what they're about. And different conferences have different sort of themes. So trying to identify a conference can be quite difficult. The best way to do this, to find the right one, is to ask somebody who knows. So that might be a professor in your department, or it might be a professor somewhere else, or it might even be on Twitter. There's a whole range of different people who can help you decide which conferences are good to go to and which aren't. And you want to make sure that the conference you go to discusses topics that are similar to yours. So there's no point in writing a really good abstract about a stroke project you've done, and then submitting it to a hemorrhoids conference, because they'll say, "Oh, this is very interesting, but this is the wrong end of the body. We don't do this." So you'll get rejected. And some of the really big conferences get thousands and thousands of abstracts submitted. So it's just important to be able to make sure that you can get that abstract to the best standard that you can. And one of the good ways of doing it, like I said before, is to go and have a look at the abstracts that appeared in the program or appeared on PubMed from the conference before. So last year, what did the abstracts look like? Was there an abstract book that you can get hold of? So you can see what they're looking for. And make sure you get lots of help and input and people to review your work and just to check it, and give you lots of feedback on it as well before you submit it. Because having somebody else read that work is really important, because that's what the person marking it will do. They've come new to this, they don't know anything about it, they're like those people you'd send it to. They want to know and understand it really quickly. And probably the most important thing is to know when the deadline is, and also to read the instructions. Most conferences will have very clear instructions about how they would like the abstract. And if you don't do that, then it really annoys people, and it makes it very difficult to read. And probably easy to reject. So if you do those things, you'll be absolutely fine. But it's also very important to remember that a lot of conferences will need to accept abstracts in order for them to sell tickets to the conference. And if they can't sell tickets, they can't have a conference. So always remember that actually you're the most important people. You're bringing their content to them. If they didn't have your content, they wouldn't be able to run. Okay, so let's get to an example of what quite an okay abstract looks like. And you can see that it has a title, and in this example, we're looking at bowel resection for gastrointestinal endometriosis, which is a condition that sometimes will need surgery to remove lesions that are on bowel or causing problems or causing adhesions. So the title of this, bowel resection for gastrointestinal endometriosis has high symptomatic recurrence rates, tells you immediately what the study is and what you found. So it's really clear, and it tells you who you're looking at and what condition you're studying and what the finding is. So if we go through it step by step, we can see what this person's done really well and maybe kind of identify areas they could improve. So remember, we've said it's really important to keep the instruction brief, so maximum 3 sentences. And here, this person has said, endometriosis is a common problem facing many women, and GI tract involvement occurs in less than 5%, some of which need surgery. We examine outcomes for patients requiring bowel resection in which endometriosis was identified as the underlying pathology. So actually, that's 2 sentences, which is good. So you know what they're doing. They're looking at endometriosis. They've said it's a common problem, and that sometimes GI tract involvement will need surgery, which is obviously it's a major problem and complication of endometriosis. And then they go on to say what they've done in the study. They've examined the outcomes, and that's what their study's about. So what do they say in the methods? They said cases, I should say, cases were identified over a 20-year period, October 1988 to October 2008, from prospectively maintained GI histopathology database. Clinical notes were reviewed retrospectively. So here they say what they've done. So they've done a retrospective cohort study. They have 20 years of these patients with endometriosis. What they don't say, though, is how they've analysed that data. They don't give you any statistics, and they don't tell you about how they've looked at that. So that might be somewhere where they could improve. So here's some results they've given. So they've said 42 cases were identified, clinical notes were unavailable for 6. In 2 cases, endometriosis was incidental at resection for adenocarcinoma. So the surgeon just found endometriosis when they were doing a cancer operation. For the remaining 34 patients, the mean age was 39 years. And then they sort of tell you about why they were there. So subfertility 13, prior treatment, and they list all of this stuff, loads of stuff. So this is actually really, they start off well. They say, we identified this many cases, and of these number weren't available. These were missing data. That's good. But then for the rest of it, they just sort of talk about, it's all kind of a bit around the houses. They talk about, this happened in 2 cases. And then they just sort of do a big list, and it doesn't really tell you much. You sort of have to look at the list and sort of try and work out what they're trying to say. There's no clear story. It's not like you've, opened a children's book and you've said, this is what happened, and then this happened, and then this happened, and then this happened, and this is what we found. It's really unclear. It's really confusing. So in the results, they could have more structure and they could tell more of a story. That would be really good. And then their conclusions. So this series represents the largest reported outside North America. Surgeons should be aware that symptoms of endometriotic bowel invasion can be variable and misleading. GI investigations may not provide diagnoses prior to surgery, and patients should be aware of high risks of symptomatic recurrence. So that's okay. That it tells you why it's important, because it's the biggest one outside of North America. The middle sentence is a bit complicated. So surgeons should be aware that symptoms of endometriotic bowel invasion can be variable and misleading. That doesn't really tell you a lot, and that that's got quite a lot of big words. So endometriotic bowel invasion is quite a difficult thing to say. Maybe they should have just said that surgeons should be aware that GI endometriosis is can produce misleading symptoms or is can lead to high rates of recurrence, and then say that investigations may not provide a clear diagnosis prior to surgery, and that you should counsel patients with endometriosis that, even if you do have surgery, there's a high chance that your endometriosis is going to come back. So we've done a lot of talking about what an abstract should look like and how to write it, and it's focused very much on keeping it simple and to the point. But as I touched on earlier, how do you actually get accepted? We have to do all of those things, or try to do all those things really well. And before you even start a project, try and work out how to make it the most important and exciting project you can, and try and work out how to make that study design and that question that you're asking really impactful. But how do you do that? Well, you can get ideas from reading other people's work. You can go around a ward and when you're doing your job day to day, just ask, why do we do it that way? Why is that way? Could we do it in another way? Is there something else that we could be doing? But usually the best way of doing this is just to bounce ideas off senior people, or people at the same level as you. Say, why do we do it this way? Could this work? Would this be better? That sort of interaction and that sort of chat is probably the best way that you can develop a good idea, because you could say, well, why do we do this surgery in this way? And the other person will be like, I don't know. That's a good question. And then you say, well, why don't we do it this way? And then they could either point out the problems or the good things about that. And you can improve each other's ideas, and you can eventually get to a point where you have this really good study that you can change the world with. So it's really common to have work rejected, and papers get rejected all the time, and abstracts get rejected all the time. It's very normal. But why do abstracts get rejected? Well, usually it's very simple, that the abstract didn't score highly enough or wasn't relevant to the conference you submitted it to. You have hundreds, if not thousands, of other people submit abstracts to big conferences. So you need to be in the top few percent of them to get a slot, really. So having marked abstracts for various conferences, the main reasons why I would say reject an abstract would be that maybe the first one is the content isn't relevant to the conference itself. So come back to if you submit a stroke project to a hemorrhoids conference, it's not going to work, no matter how amazing your stroke project is. The next one is failure to follow submission guidelines, because most people have done it right. And then you get into the pattern when you're marking these of trying to find out where the information is and looking at the different sections. If somebody hasn't followed those, then it suddenly becomes very clear about how that's been different. And then it sort of annoys you a little bit. You sort of, oh, I need to go and look at the information now. And you're just a little bit more likely to reject it. If the writing is unclear and you don't know what you've done, that's another reason. Or if you've used, if your study design isn't very good, and this is why it's really important to design good projects, then if there's another one that's done the same thing but better, then you'll accept the better one rather than your one. And the other things, particularly, are around don't overstate your study. Don't say that you're going to change the world with this very small project you've done. It's not going to work. If your conclusions don't support the findings, then that's also a very clear reason to reject. And sort of the projects that do, they'll sail through, they'll get accepted really easily, are the meta-analyses and systematic reviews and randomized control trials. They're the sort of ones that will get through in the easiest way. But they're also some of the trickiest ones to do well. So it's all about sort of balancing up, do I put lots of effort into my study and do like a randomized trial, or do I do a very easy study, but it's less likely to be accepted into conferences and paper journals and things. So there's lots of different types of study designs, and there's things like case reports, which you describe one or two patients and you say what you learn from them, or you describe a new technique. And these are the most likely to be rejected because they're not very scientific, and they might be interesting, but they'd have to be interesting to the person who's marking your abstract. Systematic review might be a good one to do. It's quite straightforward to do, and they're reasonably quick to undertake. And so that might be quite a useful one to do. And then simple audits are also very, very attractive to do at a local level. But if you try and submit these to an international national conference, you probably get rejected because then you don't have any sort of interesting new data. Yeah. So be really careful with the conclusions. There's lots of these studies that say this drug will kill cancer cells, but so does bleach and so does a handgun, according to this cartoon. You don't overstate the conclusions. Be really careful. The other things that you should avoid, lots of abbreviations, lots of words. So it's too wordy, it's difficult to read, and it can be confusing. Quite a lot of people like to use very exciting terms like paradigm shift. I don't know what that means, first of all. And second of all, it's sort of overstating again. People making spelling and grammar mistakes. You shouldn't get rejected for that, but it's important to make sure that these things are clear, and spelling and grammar mistakes can lead to problems. And making sure that there's a clear story that goes through the introduction, methods, results, and conclusion. Make sure they all match and they all kind of flow through. And everybody's been rejected. Everybody's put an abstract in has been rejected at some point. I know I have. And papers in journals get rejected all the time, and I often go through 2 or 3 submissions before actually finding the right journal. And so it's really common. So how do you deal with all that rejection all the time? It's very easy to give up, but don't give up. It's not personal at all, and it's not a reflection on your work. Your work's probably fantastic, but you just couldn't fit it in. You need to just see what you can learn from it. So you're not likely to get feedback from the conference markers as to why your abstract was rejected, but maybe you could get feedback from somebody else. So a senior colleague could look at your abstract, or your fellow colleagues, and they can tell you how to improve it. And that's really important, particularly if it's been rejected. And the more you practice, the better you get at it. So my first abstract probably was absolutely awful, but now I can write them in my sleep. It's really, really very straightforward. So you just need to practice, and you don't necessarily need to submit to conferences to practice it. These can be for anything. So you can submit journals and various other things, or just write a summary of what you've done. And the important thing to realize is that there's so many abstracts now. There's thousands and thousands and thousands, and they're just increasing year on year and year. So, stuff like case reports and reviews and trials and things like that are the much more rare abstracts and the sort of lower volume type things, so they're much more likely to be accepted, whereas case reports and expert opinion there's thousands of articles in that. So if you try and target it at really good things, so the trials and the systematic reviews, and you have a good study that does that, then that's probably the best way to get your conference abstract accepted. So that's me done. I'm just going to summarize now by basically saying that abstract writing is, as you've sort of gathered, is much broader than just writing an abstract. It's about your study design. It's about how good that study is. It's about planning ahead. It's about trying to gather a team to review your work and to help you to just build this abstract up. It's about writing really simple stuff in a really clear way, but also making that really count. So telling a really clear story without going on for too long. And if you can do that, then there's no reason why anybody in the world would reject your abstract. And it's also, yes, it's much better if you submit it on time. I always end up submitting an abstract right on the deadline, despite doing these talks and saying, don't do that. Make sure you do it weeks in advance. But I always submit on the deadline anyway. It's always, that always happens. But yeah, so it's a much broader thing to do than just writing. You have to think about all these different aspects, but when you do it, it will come together very nicely. And now, if anyone's got any questions, could you put them in the chat and I'll just answer them. But thank you so much for your time. And it's really nice to speak to wonderful people that I've met before and some new faces as well. So if there's anything I can help with, just let me know. Thank you.
Great, Tom, thank you. Thank you very much. That was an excellent presentation. I can't imagine the number of times I've sat down for 2 hours trying to get the last bit of the discussion and conclusion in an abstract. And it's really nice that you summarize it anatomically for us. Actually, I'm excited that you can actually write out everything you have in mind and then just delete what you don't need. That makes things a bit more simpler. Really thank you for that. If anyone has any questions, please put them in the chat and we can pick it up. Or if you have any questions, you've texted me, I'll just ask straight away. So Tom, there's a question here. So we have a few people, actually a number of people in the program who've started writing up some work, and we have some groups doing some systematic review and meta-analysis. Now, most of these conferences, for some of them, like you said, they would ask you to pay some money to register for the conference and then present your abstracts. I'm aware there are some conferences that would give some waiver for people from low middle income countries like Bethune Roundtable Conference and some, I think, World Congress of Surgeons that has something similar. If you have any conferences like that, you can point us to, that would be very helpful. So when these guys are done with their projects, they can at least get somewhere to submit them.
I think there are quite a few. And again, you mentioned those conferences, they're really good. I don't know if you go to Kasetska, that's a sort of a good one as well. The things, yeah. The thing is that a lot of so the way a lot of conferences work is you have a big society, say, who will run the conference, and they have a lot of money. And so the big international societies will often do waivers, or they'll do heavily discounted things for people in low income, middle income countries. So they're the sort of conferences you want to go to. So yeah, and it's sort of the ones that are a bit lower down. So maybe like the national conferences or the sort of the smaller ones, they don't have as much money, so they won't be able to offer those things. So I think, yeah, I think those ones you list are very good. I don't know of any others off the top of my head because things always change. But I would highly recommend the approach of go to what you can afford. Don't spend lots of money on conferences at all. I think, you know, lots of people can spend a lot of money very easily on them. Some of them are very expensive for what they are. So yeah, I would go with that. Teddy, those ones are really great conferences, and just make sure that you pick ones that aren't swindling you, aren't taking all of your money. All right. So I've got a question in the chat. Can I read that out?
Yeah. So
we have a question, a really great question actually. Oh, two really great questions. Well done, everybody. Keep it coming. So the first one is, for the author lists, you mentioned the most senior person comes last, is this irrespective of his or her level of involvement in the work? So when we say senior, we mean the person who's overseen the project. So usually that would be the most senior person involved. So that could be a professor, but also if the professor hasn't done a lot and it's been somebody, maybe like his assistant or something who's been, or her assistant who's been supervising you, then they should go last. It's the person who is most senior but has done the most amount of work on the project. What you need to do before you submit an abstract is send that abstract around to everybody involved. So, if there is a very high-ranking professor, they can say, I want to go last, or I want to do this, I want to do that, and then you negotiate. So we've got a great question from Kingsley, who says, about keeping language simple, what about words you can't substitute with certain specific jargon? And that's okay. If you need to use jargon, but it's important to minimize the use of jargon. Only use it when you need to. And so it's really difficult, I find anyway, to read pages of jargon. Whereas if only jargon is like written a couple of times, I can focus on what that jargon actually means and say, well, this has been used really well. I know what that is, rather than trying to read all the words around it. And we've got another question to follow up from the first one, which is the most senior person the one with the highest academic achievements? And again, the response is not necessarily. It's the person who has supervised the project that you've done. So if somebody has sat down with you and said, this is what you're doing, this is the project, these are the bits of research you need to do, this is the analysis you need to do, that's the person who's your supervisor.
So, Tom, just in line with the authorship, would you advise that authorship should be sorted out before the project even started?
I think that's definitely the best way to do it. So, before you start, obviously that, doing it really early on can be quite difficult because you don't know who's put in the most effort. And so if you say, well, you're going to be first author, but that person does nothing, then you'll have to renegotiate. But quite often, going into projects, it's a good idea to say, look, here are the expectations. This is what we should be doing. If we all do equal amount of work, or if we all do lots of work, then we'll both go as first. Or I'd like you to be involved as a first author or as a second author. Being upfront about it is really important, because then you avoid any awkwardness later on. It's a really good way of making everybody happy, because I don't know about you, but sometimes people where I work can get a bit annoyed if they're left out or they're put in the wrong place. And just being very clear and upfront about it, and just saying, we're doing this, I want you to be involved. And if you do lots of stuff on it, I'd love you to be first, second or third author. And even saying to people before you start a project, to say, look, I want you to be an author on this paper. I don't know where I'd put you. We'll have a look at the end just to see, how much everyone's contributed. That's also a good way. So you're being very upfront about it. You're saying, we want to include you, but I don't know where to include you yet because it's not happened. And it just kind of avoids any uncertainty about people feeling left out, or feeling that you're taking their expertise or their advice for free.
All right, thank you very much. Tom, are there any other questions from anyone? You can just unmute and ask. Otherwise, I'll just call Dr. Osai to just give us any information announcements. Tom, thank you very much.
Thank you, everybody.
Brilliant presentation, very helpful.
So Tom, thank you so much for the presentation. I actually learned a lot.
It was really nice to see you again as well. So yes, thank you for inviting me, everybody.
Okay, so we have another webinar on Friday by Dominic Vervot. We'll be sharing the details later after the meeting. So just watch out on the WhatsApp pages and our Facebook handles. Okay, thank you everyone for coming. We really appreciate your time.
And hello.
Yeah, hello.
Yep,
Teddy.
you're welcome.
Yeah, thank you everyone. Yeah, see you on the next webinar.